Hi, I'm Matthew Clausen, and welcome to video number 5 in our series all about Medicare, a series of videos meant to help the people new to Medicare learn all you need to know to make an informed decision about your choices. In this video and the next, we are going to talk about the most important decision that you have to make as you start Medicare. It's important because it will define the quality of coverage you have, the amount of coverage you have, your flexibility, and your cost. When you start Medicare, you have the choice of keeping your original Medicare Parts A and B, we've talked about in previous videos, or switching to a Medicare Advantage plan, which is a private plan run by a for-profit insurance company. Original Medicare is the Medicare Parts A and B, as we've talked about in our second video of this series. In this video, we're going to talk about Medicare Advantage plans. In our next video, we're going to discuss Medicare supplement plans. Now, it's important to understand this is an either-or situation. You cannot have a Medicare Advantage plan and a Medicare supplement plan. My intent is to put the facts, the pros and cons of each plan type in front of you so that you can make a decision. But just remember that this is not my health care. This is not your friend's health care. It's not your neighbor's health care. This is your health care. What is right for your friends or neighbors is not always what's right for you. And I have found quite often that after having these discussions or the information that we have in these videos for you, you'll find that you may know more about Medicare than many of your friends and neighbors. Not everybody takes the time to research their options as you are already with these videos. So let's talk about Medicare Advantage plans. If you decide to have a Medicare Advantage plan, that plan replaces your Medicare. It doesn't enhance it, it doesn't supplement, it replaces it. When you choose a Medicare Advantage plan, all of the benefits and the appeals processes that are outlined in your Medicare and You guidebook are no longer relevant. Your new benefits will be detailed in your insurance company's evidence of coverage document, and any changes will be sent to you typically in October in what's called an annual notice of change. You no longer need to show your Medicare card to your doctors. You will have a new insurance card from your insurance company. And if you have questions or you have a problem with one of your services, you can no longer appeal your services to Medicare. Medicare is no longer involved in your day-to-day health care. Any appeals process has to go through the insurance company that you're now working with. Medicare Advantage plans are typically an HMO, Health Maintenance Organization, or a PPO, a Preferred Provider Organization. We'll go through the details of those in a minute. But first, it's important to understand that a Medicare Advantage plan is not standardized. It's regulated to meet a certain minimum requirement. That's an important concept, so let me explain. Medicare Part A and B is a standardized plan. Medicare supplements, which we'll discuss in the next video, are standardized. Every person in Medicare Part A and B gets the exact same coverage. Everyone in a Medicare supplement plan has the exact same coverage. They can see the same doctors. They will have the same experience. With a Medicare Advantage plan, each plan is different. It'll have a different co-pays, different cost structure, cover different services in a different manner. It will have a different network of doctors and hospitals that you can see. Everyone in a Medicare Advantage plan is going to have a different experience, and that experience will depend on which company that they have chosen and which plan within that company that they have chosen. In addition, all those benefits, those co-pays, and the doctors can and will change each and every year. It is your responsibility to keep up with those changes via their mandatory annual notice of change and determine how that is going to impact your health care in the coming year. Medicare Advantage plans are regulated to meet a certain minimum standard of coverage, and that minimum standard of coverage is referred to being actuarially equivalent to Medicare Parts A and B without a supplement. Actuarially equivalent. That's an interesting term. What exactly does that mean? Well, first, a Medicare Advantage plan has to cover the same procedures that are covered under Medicare Parts A and B, but not necessarily at the same cost. Actuarially equivalent means that over a large group of people, everybody on the plan, the average cost for a person is going to be the same as if they had just Medicare Parts A and B without a supplement. Well, if the average cost is the same as the Medicare Parts A and B that you already have, then by definition, that means that half the people with a Medicare Advantage plan are going to have lower costs than if they just had Medicare Parts A and B, and half the people are going to have higher costs than if they just had Medicare Parts A and B. Which half will you be on? So let's take a look at HMOs and PPOs, which make up the vast majority of all Medicare Advantage plans. There are other types of plans, and you may want to take a look in your Medicare and You guidebook to see what plans are and if they have an interest to you. And then keep in mind that what I'm going to discuss here are generalities. As I mentioned, every plan is different, so please check the specifics of whatever plan that you are researching. An HMO, a health maintenance organization, that's known historically for very good preventive care services. With a Medicare HMO, you will have to stay within a network of doctors. It'll be a group of doctors in your local area, perhaps even confined to your county. If you seek medical service outside of your network, it will be at your cost, at your dime. There is no coverage for out-of-network service. A couple of bullet points to consider. The exception to out-of-network coverage would be for emergency care. If you are out of your county, out of your local service area, and you have an emergency, then you will be covered for emergency care. However, check the evidence of coverage for how they define emergency care. There are some plans where the definition is restricted to stabilizing you, to making sure that your life is no longer in danger. After that point, it's up to you to get back to your service area for additional coverage. For example, if you are off in another state and you get in an automobile accident, your coverage will pay for making sure that you are stabilized. But even if you're in traction, it's up to you to get back to your service area to have any other additional insurance coverage. That information will not be on the summary of benefits that an agent will sit down and show you, but it should be in the evidence of coverage. So make sure that you understand that when you take a look at this option. A second point to consider is that you will be required to have a primary care physician. The primary care physician will direct your health care. You cannot see another doctor or go to any other service without a referral from your primary care physician. Any doctor visits outside of that and without having permission will not be covered. A PPO, or a preferred provider organization, is a little bit different than an HMO. You will also have a network of coverage that you have to stay within. However, there are some PPOs called a regional PPO where that network, instead of just being in your county, could be as large as doctors within your state or within a multi-state area, and in some cases even doctors all across the country that are contracted with your insurance company. So you can have a much larger in-network service area. In addition, the PPOs will typically also have insurance coverage for out-of-network service, just at a higher cost. A couple bullet points to consider. You may have to also have a primary care physician. However, you will not have to have referrals from your primary care physician in order to have coverage. You should be able to see any doctor or specialist that is in your network. Because the network can be so large as even being multi-state, and because you have out-of-network coverage, that scenario of being out of state and in an accident is a non-issue. All Medicare Advantage plans have an annual MOOP, M-O-O-P. Stands for an annual maximum out-of-pocket expense. It's the maximum that you will spend through all their copays and deductibles before you get 100% coverage. That maximum is calculated on a calendar basis. Please note that that MOOP refers to covered services. In an HMO, for example, out-of-network is not covered, therefore there is no MOOP or maximum out-of-pocket for out-of-network services. It is all on your dime. Also, for those Medicare Advantage plans that have prescription drugs and those costs are not included in your maximum out-of-pocket expense. Most of those PPOs, the preferred provider networks, have a different MOOP for in-network service versus out-of-network service. For example, what's common right now is that an in-network maximum out-of-pocket expense for an annual calendar year basis might be $6,700 in-network and $10,000 for out-of-network coverage. The out-of-network service may also have a deductible. Because every Medicare Advantage plan is different, and some companies even have more than one Medicare Advantage plan, comparing plans can be a little difficult. We're going to go over how to compare plans in a moment, but first, it's usually at this point in the conversation that I'm asked, why? Why do people choose a Medicare Advantage plan? Now, keep in mind that across the country, only 3 out of 10 people who do enter Medicare will choose a Medicare Advantage plan. In some areas, especially rural areas, that could be as low as 1 out of 10 people. But in my experience, the number one reason that people will choose a Medicare Advantage plan over keeping their original Medicare and adding a supplement is economics. Although the cost of a Medicare Advantage plan is no different than the cost of original Medicare does not have a MOOP. There is no maximum out-of-pocket limit when you have original Medicare without a supplement. Having a Medicare Advantage plan is a great way to set a limit on how much your medical expenses will be without creating any additional costs. If you're a senior on a fixed income or a lower income and just on a tight budget, the Medicare Advantage plan may be the right option for you and should definitely be considered. The number 2 reason in my experience for why people will choose a Medicare Advantage plan over original Medicare is that they didn't know they had a choice. I can't tell you how many times that I have heard that, well, an agent came in to talk to us, they opened up a book, showed us a Medicare Advantage plan, told them it's better than Medicare and it's free, and they went ahead and made that decision. No additional research, no looking at all of their options. Please be aware that although Medicare Advantage plans have no additional premium to you, they are the highest commission product in Medicare. They pay the agent from 2 to 5 times more than any Medicare supplement. In my opinion, if an agent sits down and the first thing out of their book to show you is a Medicare Advantage plan without first taking a look at your options with a Medicare supplement and those costs, you're likely sitting down with someone who is more concerned with their pocketbook than with your needs. Also, we often hear that Medicare Advantage plans are free. Well, they're not technically free. You actually pay the same that you pay for your Medicare Part B. And if you remember from another video that you have a premium every month that you'll pay at least $122 a month as of 2016, you pay for Part B. Well, you still pay that with a Medicare Advantage plan. That doesn't go away, but the money goes to the insurance company rather than to Medicare. So technically, no, a Medicare Advantage plan is not free. The number 3 reason that I have seen that people will choose a Medicare Advantage plan over original Medicare are the additional services that are often put in there as teasers. It may be free dental cleanings, for example, or some other services that give you an impression of a more broader coverage. Many of those additional services can actually be replaced with a discount plan, maybe paying $10 a month. So don't get lured in by all of the little bells and whistles and really focus in instead on your primary health care. We'll talk about that when we go through comparing plans. Now, if you're like most people at this point, you're wondering, how does an insurance company offer health insurance without charging a premium, or with that just $122 a month Part B premium? And to that, I'm going to add, well, they not only do that, but they have fancy marketing materials. They pay the agent or the broker many times more than they would elsewhere. They can do that because what our U.S. government through Medicare does is pay the insurance company between $1,000 and $1,500 a month for every Medicare Advantage plan they have. That's $18,000 a year per person. Second is that the insurance company has the right to deny you service if, in their opinion, the service you're looking for is considered not medically necessary. You may recall my emphasizing that term, medically necessary, when we discussed Medicare Parts A and B. Medicare uses your doctor to help determine what is medically necessary for you. Medicare Advantage plans do not. They use their actuaries and other employees to determine what is medically necessary. By doing so, denying you coverage has a positive impact on their bottom line. So moving forward, in addition to PPOs and HMOs, Medicare Advantage plans also fall into two different categories. There are MA for Medicare Advantage and MAPD for Medicare Advantage prescription drug programs. Medicare Advantage plans without prescription drugs were designed mostly for veterans. Veterans through the VA may have a very good prescription drug program. They also have a health program, but will often seek out their Medicare as a backup. So the Medicare Advantage plan without a prescription drug plan or a high deductible Medicare supplement can be a great alternative backup coverage. You should know from our other videos that not having a prescription drug plan or any creditable prescription drug coverage will result in a penalty. Thus, other than veterans, most of us will consider the Medicare Advantage prescription drug plan when looking at Medicare Advantage plans. However, a very important point, you cannot have a Medicare Advantage plan of any sort and a standalone prescription drug plan. In fact, whenever you sign up for one, it would cancel the other. If you have a Medicare Advantage plan and you sign up for a standalone prescription drug plan, Medicare automatically cancels your Medicare Advantage plan. If you have a standalone prescription drug plan and you sign up for a Medicare Advantage plan, Medicare automatically cancels your prescription drug plan. The Medicare Advantage prescription drug plan is just a Medicare Advantage plan with a bundled prescription drug plan. If you have a Medicare Advantage plan with a prescription drug plan, you must take that bundled prescription drug plan. Your prescription drug plan can have its own separate deductible. It will have its own separate cost for its drugs, its own formulary, which is the list of drugs, and it will be different than all of the other prescription drug plans. And as I mentioned earlier, the money spent on the deductible and the drugs for the prescription drug plan does not count towards your maximum out-of-pocket expense. Now let's talk about the annual election period. It's also known as open enrollment. Because Medicare Advantage plans and prescription drug plans change each and every year, they are required to send you an annual notice of change in early October. Then you have from October 15th through December 7th to evaluate those changes and decide whether you want to keep that plan or change to a new plan. So that period, October 15th through December 7th, is your annual election period, or it's also referred to as open enrollment. If you decide that you want to keep a plan that you already have and you like the changes that will be coming in the next year, do nothing. It will automatically roll over. If you're not comfortable with the changes for the coming year, then sit down with an agent, take a look at all the different plans that are available to you, and decide which is going to be best for you. And again, you have from October 15th through December 7th to make that decision, and then your new plan will take effect on January 1st and will go from January 1st through December 31st. If during that open enrollment period you change your mind Any new plan that you choose will automatically cancel your old plan. And that's true with both Medicare Advantage and prescription drug plans. So if you have a Medicare Advantage plan, you apply for a new plan, and then somebody shows you a different alternative you didn't know and you want that one, the final application that you make during that open season, that open enrollment period, will be the plan that you'll have for the next year. You can only change plans during your annual election period from October 15th through December 7th. However, you can cancel a Medicare Advantage plan or a prescription drug plan between January 1 and February 14th. If you want to change back to original Medicare from a Medicare Advantage plan, all you need to do is sign up for a standalone prescription drug plan during the annual open enrollment period. Your Medicare Advantage plan will automatically be canceled. However, if you are going to do that and you want a Medicare supplement, make certain that you qualify for the Medicare supplement before you make any decisions. We'll cover more on that when we talk about Medicare supplements in the next video. If you have decided that you are more interested in a Medicare Advantage plan than keeping original Medicare, how do you compare those plans? This is what I suggest. First, decide if you want an HMO or a PPO. Because they are different, they provide their health care in a different manner, you should have a preference of one over the other. Second, check the network, especially if you already have a doctor. Make sure your doctor is part of that network. If you prefer a PPO, check to see if there's a regional PPO available to you that will provide you with a greater in-network service. Then look at the MOOP, the maximum annual out-of-pocket expense. It might be a good idea to examine what it would cost under certain scenarios. So consider a cancer or a heart attack. What would your plan cover? What would be your out-of-pocket expenses under certain scenarios? And lastly, if two plans are very similar, then take a look at the star rating. Now, we talked about the star rating in our last video on selecting a prescription drug plan. You also have a detailed look at star ratings and how they're used, how they're measured in the Medicare and You guidebook. So take a look at that as well. So if two plans are very similar, maybe the one with the better star rating is the option you should consider. In our next video, we are going to discuss the pros and cons of the Medicare supplement plans. If you like our videos and find them informative, the chances are others will too. Please like and share these videos. If you're watching this on YouTube, then take a look down for the thumbs up and give it a thumbs up. When you do, that improves the probability that when someone else is looking for answers just as you are, that they will find this video. And please share with your friends. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.